Hey everybody, welcome back to Ask Dr. Barry. I have an interesting subject today that really, when you think about it, is not discussed nearly enough, both in medicine and I think in society in general. And I like to call it the philosophy of expectations, right? Throughout my years in the emergency medicine business, what I learned early on is that it's very important to set up the appropriate expectation for the visit for the patient, right? And this kind of goes back to what I like to call my rule of fives, right? And the ER is a great place to utilize the rule of fives. 5 seconds, 5 minutes, 5 hours, 5 days, right? 5 weeks, 5 months. Believe it or not, people would come into the emergency department with 5 years worth of problems. Quickly, I learned that the expectation for that patient's visit needs to be managed, right? On the other hand, that 5-second or 5-minute problem, right? That's the problem that the emergency clinician is truly trained for. So the setting up of an expectation on any doctor-patient relationship visit is really what it's all about. If somebody comes into my clinic today in the medical cannabis practice, for example, right, and they're looking for a solution and an answer 100% to all of their problems, all right, well, that would be a very, very slippery slope, okay, for any clinician to promise a patient that they're going to have a 100% solution to 100% of their problems. I suspect there are doctors that do that, but they can't have very happy patients or very successful practices. The more experienced clinician is well accustomed to making sure that the patient has a good understanding of what it is that you can do for the patient with that problem. That's what makes cannabis so unique to that extent, is that we really don't know in a lot of ways what response we're going to have, right, with each individual patient with the list of problems that they may have. But we do know one thing is the safety of cannabis allows us to appropriately educate, counsel, and teach.
So I just want to understand what these guys do. And so early on, I knew that we needed a spoken wheel set up, so to speak, where after I spent my time with the patient, I had experts come in and spend their time with the patient discussing products further. And we don't discuss dosing in the clinic necessarily, but delivery methods, that layering technique that allows the patients to mix up that safe witch's brew, quote unquote, so to speak, that's always safe. And then these guys help the patients tune it in and learn about the products.
You have to have the appropriate expectations as a patient, right? You also have an appropriate expectation as a doctor to the extent of how your patients are going to follow your advice. That's another Ask Dr. Barry all in itself, is the discussion of compliance, right? And when the doctor asks you to take your, 3 doses of amoxicillin for 10 days, how many actually do that? Who leaves antibiotics in the prescription bottle? Pretty much everybody. That's why Zithromax is Zithromax. That's why it's once a day for 5 days. Gives you 10 days worth of coverage like 30 pills would. So the compliance issue is also key. So you have to have the appropriate relationship with your doctor to have the appropriate expectations to the extent of how that doctor can help you. Also, you want to make sure that you're honest with your doctor about the symptoms that you have. We find that all the time, is that patients aren't always necessarily honest to the extent of how much something either does or doesn't bother them, right? So it's all about developing that communications, right, avenue with your doctor so that he understands why you're there and that you understand what it is that he can do for you. So once again, it's all about communications, expectations, compliance. And once again, these are all issues that aren't necessarily discussed every day in the healthcare environment, but are critical to each and every patient care visit.